A mood disorder is a long-term serious condition that is characterized by elevation in a person's mood, ranging from high intense elations to low depressive states. So we have a number of mood disorders that could range from major depressive disorder. We have persistent depressive disorder. We could have bipolar disorder. We have premenstrual dystrophic syndrome and others. So in major depressive disorder, a patient will experience periods of intense low levels of energy for a period of around 2 weeks, and these patients usually require some bit of hospitalization at that moment. Whereas in persistent depressive disorder, these patients tend to experience these symptoms of low energy that could go up to a period of more than 2 years. Then in bipolar, these patients tend to experience symptoms of low levels of energy and high levels of energy throughout their lives. These energy levels keep alternating from one cycle to another, depending on which form of bipolar they're actually experiencing. Premenstrual dystrophic disorder is experienced by women, especially a week before, during, or after their menses. So, some of the causes of these mood disorders could range from biological causes, where a patient experiences some level of imbalances or chemical alterations in their body, and these alterations usually lead up to these symptoms. Environmental factors could also contribute to this, where we consider things like stress to be some of the major contributing factors. Childhood experiences and trauma could also account to that. We also have substance abuse that could also contribute to that. We have genetic factors that could also contribute to this, where family history is highly linked to some of these conditions. Some of the common symptoms that can be experienced by these patients can range from emotional to behavioral changes. The emotional changes could include things such as irritability, reduced self-esteem, feeling of worthlessness, and intense sadness. Then the behavioral symptoms could include things such as loss of appetite and loss of sleep generally. But however, some patients can experience both of these symptoms at the same time, ranging from both behavioral and emotional symptoms. So mood disorders can have a significant impact on someone's life, where some patients can be totally affected and they're unable to work or fully function very well. Some patients can actually be affected to an extent that they're unable to socialize normally with their friends, so they go into social withdrawal. To some people, it can be so bad in that they'll eventually develop suicidal tendencies or suicidal thoughts with time. There are a number of interventions that can be used to manage these mood disorders. This could range from psychotherapy, where we have the cognitive behavioral therapy. We could also have medications that can be initiated in these patients that could range from antidepressants, antipsychotics, and mood stabilizers. We could also advocate for lifestyle changes, such as improvement in diet. We could also advocate for social support for these patients to see that they actually get to become better people. The treatment period for a mood disorder will vary from person to person, depending on their response to the different interventions that have been put up. But however, it's normally under supervised qualified personnel's recommendation that we can eventually stop giving therapy to this person or you can continue. But treatment varies from person to person depending on how they respond to the different intervention. In case you've experienced any of these symptoms or have had any of this, you are not a failure, you are not broken. Things can actually get better. Reach out to a counselor, a trained medical personnel, or anyone else who you think could offer help to you. Please, don't die in silence. Your health matters.